Hello everyone, welcome to today's conversation. I'm gonna just wait for guys to jump in. So I'm gonna give a buffer of like a minute and wait for guys to just jump in. Then we can kick the conversation. Let me know when you join in. Say hello, ask questions. Just wave at me when you come in. It's good to have you on board. Thanks for coming along. Just gonna wait for like 45 seconds, waiting for guys to come in, and then we can start the conversation today. Hi Kate, it's good to see you. Thanks for jumping in. Don't know where you're watching from. Great. So I'm just gonna start. As guys jump in, they will find us moving on. Yeah, and as you join in, just wave. Let me know where you're watching us from, and then we can give a shout out to you. So today we're going to be talking about dealing with cracked nipples when you're breastfeeding. This happens pretty much to every mom, but new moms experience it a lot, quite often, because it's their first time to breastfeed and their nipples are not used to it. So just to start, let's talk about what causes nipple soreness. Number one is the normal tenderness that happens due to the sucking that comes with the baby, but it can be prevented. But just to let you know that it's almost like 100% that you're gonna expect it between the first and the second week of breastfeeding. And then moms whose babies suck vigorously might experience it for longer, or might experience the soreness of the breast for a longer time. Another thing that causes the soreness of the nipples and the cracked nipples is latch issues. Latch issues is when the baby is not positioned well when breastfeeding. And so as a first time mom, it's good to know how to latch a baby just before you leave the hospital. Ask the nurses. This is more of an experience than theory. Like, you need to be shown how to do it. It's not just theory. So just before you leave the hospital, if the nurses don't offer it, ask for it, because you will need it. When you get back home, you will be alone. Hi Meg, thanks for joining us. When you get home, you will be alone and you will have pretty much maybe no one to show you. So ask for it before you leave the hospital. But it's also good to know that the baby doesn't know how to latch immediately. So you also need to be patient. Sometimes they will latch well, sometimes they will not latch well. So it's an art and it will take time before they learn how to do it. But the minute they learn to do it, you begin getting comfortable with it with time. So again, the bottom line is, as I usually say, is be patient with yourself. The other thing that causes nipple tenderness or soreness of the nipples is the pumping equipment, especially for moms who want to express milk immediately after delivery and start storing it. It's good to find out the right equipment to start pumping with, because when you use a large flange, it can cause discomfort and soreness. Or if you pump vigorously and apply a lot of friction, it can cause the soreness of the nipple. So it's good to find out the good equipment and the right technique to do it. The next thing is the nursing bra. When you're choosing a nursing bra, it's good to note that your breasts will expand, because, or rather they will not expand, that's a bad one. They will become bigger because the occurring milk, I mean. So it's good to get maybe an extra size than the one that you're used to before, because you will need it. When you get a small nursing bra, it will apply pressure on your breast or on your nipples, and that might cause soreness of the nipples and make you uncomfortable when you're breastfeeding. The next thing is, if your nipples are too dry, there's a probability that you will develop breast soreness, or even at the end of the day, cracked nipples. So it's good to watch and make sure that your skin is not so dry or your nipples are not so dry. And then the other one is mastitis. This is an infection that happens when germs from the baby's mouth come into contact with the nipples of the mom through a crack. So that will end up causing mastitis. And for this, it's good for you to see a doctor because it needs to be treated. As they usually say, maumivu yakizidi muone daktari. It's good for you to see a doctor if you realize you are developing mastitis. So let's talk about treating sore nipples or nipple pain when you're breastfeeding, because as a mom, you will need to know how to manage this or how to deal with it, because it happens to all moms really. So number one, and the most effective way, is to just apply breast milk on your nipples. That is after breastfeeding. The antibodies in the breast milk will help the nipples heal, and they will also soothe them. So it's good to note that. Just after breastfeeding, just express a little bit of milk and apply it on the nipples. That will help them heal, and it will also soothe them. Not forgetting that the antibodies will also help. It's also good to use ultra-purified lanolin. Before breastfeeding, you can apply, it's safe for the baby. Before breastfeeding, you can apply on the nipples, and after breastfeeding, you can also apply on the nipples. And it is also said that if you apply before the nipples crack, it can even prevent the cracking. So it's good to note that as well. The other thing is, apply a warm saline compress. Saline compress is basically, you can put a little salt on some water and put a clean face towel or good towel, and then apply on the nipples. That will soothe you, and it will also help with the healing of the cracked nipples. But that is before breastfeeding. You can apply the warm compress. The other one is soaking the nipples in salt water. This will also help soothe the pain, and it will also help heal the cracked nipples. The other one is you can alternate sides when you're breastfeeding, especially if one side is more tender than the other one. You can decide to start with the less. Hey Faith, Ndanu, it's good that you joined us. Thanks for joining us. It's good that you start with the less side that's not tender. That way the baby will suck more vigorously on that side, because when they start sucking, they're hungry and they have all the energy, so they will exert all the energy in that breast, on that side that is not tender. And then by the time you're moving to the other side, it's less pressure for you. So it's good to alternate sides. That will help you as a mom to feel less much pain. And then the other one is you can use a nipple guard. I had one and I have looked for it to come and show you guys, but I didn't find it, so it's fine. But you can find it in any pharmacy or drugstore. A nipple guard is something that you just put. It's like it looks like a pacifier. Well, not a pacifier, but you just place it next to the nipple, and then the baby can suck through. That helped me when I delivered my first baby, because I had cracked nipples and I had sore nipples, and to some extent they had started bleeding, and it was really uncomfortable and painful for me. So I used a nipple guard for like 2 weeks. So the baby, what happens is the baby sucks through it, and so they don't exact pressure directly to the nipple. That really helps. If you really need it, you can get it in a pharmacy or a drugstore, but it's not recommended for you to use for a long time, because when the baby gets used to it, they're not able to, they will not like to suck directly from the breast. So it's good for you not to use it for a long time. Just use a period of time until you get comfortable enough to go back to feeding the baby directly, or until the baby is able to latch well. That way the baby will benefit and you as a mom will benefit as well. And then lastly, you can consult a lactation consultant if you really feel that you need help to breastfeed, because this is your baby's food. If you have decided to breastfeed for the next 6 months, for the first 6 months, it's good for you to see a lactation consultant, because if you don't kick it off well, you might not enjoy breastfeeding. You might have a not so good experience at the beginning about breastfeeding, and that might affect you. So if you really feel that you need help, consult a lactation consultant, or talk to a former mom who has had a good experience in breastfeeding. Make them your resource. That way you can ask questions, you can share, your discomforts, and they will be able to help you. So thanks again a lot for joining me today. I am grateful and I'm thankful that you came along. And that was it for today. Thanks for joining me, and I'm going to be seeing you again next Friday. We will tell you the topic that we will be discussing on Friday. Don't forget to subscribe to our social media channels. Go to YouTube, subscribe to our YouTube channel at I Am a First Time Mom. Go to Facebook and subscribe as well, the same handle. To Facebook, to Instagram, follow us, it's the same handle. And yeah, let's get talking. Let's encourage each other. And if you're a mom and you have given birth before, spread the word, encourage new moms. I cannot insist enough how new moms need encouragement. There are so many things that new moms don't know about, and no one talks about them. And if they talk about them, sometimes it's hushed conversations. So as a mom who's given birth before, please help new moms and encourage them. Thank you very much. I'm going to be seeing you on Friday. Bye.